Well, good afternoon, everyone. I'm pleased to welcome you to our webinar on preventive care and healthcare transition, bringing them together with Hawaii Title V, Improving Adolescent Care. This has been a collaborative effort with the GOT Transition, the Adolescent and Young Adult Health National Resource Center, and our Hawaii Title V program. I'm very excited to introduce our distinguished guests from Hawaii. Dale Matsumoto Oi has been an audiologist with the Hawaii State Department of Health for over 30 years and leads their Title V work on transition to adult care. She also provides audiologic services to deaf and hard of hearing children from birth to 21 years of age. And at home, Dale has two, she says, some 20-something-year-old sons who are her sounding board and guinea pigs on healthcare transition. Welcome, Dale. And Punaho Aina is a child and youth health specialist with the Hawaii State Department of Health's Adolescent Wellness Unit. And Punaho manages the state personal responsibility education program, or PrEP, and abstinence education grants to educate young people on both abstinence and contraception and provide resources and training for community-based teen and young adult serving programs across the state. He has worked with the adolescent to young adult population for the past 20 years. I also want to give a shout out to Dr. Patricia Hugh, the head of Hawaii Children with Special Healthcare Needs Branch. Pat and her team have for many years been leaders in the healthcare transition field. I'm also happy to introduce Dr. Charles Irwin, who is the project director for the Adolescent and Young Adult Health Resource Center and the co-PI for the Adolescent and Young Adult Health Research Network. He is also Distinguished Professor of Pediatrics, Director of the Division of Adolescent and Young Adult Medicine, and Director of Health Policy in the Department of Pediatrics at the University of California, San Francisco School of Medicine and UCSF's Benioff Children's Hospital. I'm also pleased to introduce Annie Schmidt, who is a Research and Policy Associate at the National Alliance to Advance Adolescent Health, where she plays a leadership role in our work on preventive care and healthcare transition, our value-based payment and quality measurement work, and Annie also co-chairs our GOT Transition National Family Advisory Board. So we are really excited to have this opportunity from our colleagues from Hawaii about aligning healthcare transition and preventive care. And we encourage you to put your questions in the chat as we go along. And at the end, we will be responding to your questions and look forward to an interchange. So with that, I will ask Annie to forward the next slide. We have no disclosures. The presenters have no disclosures, and the funding for this effort is through the Maternal and Child Health Bureau, Health Resources and Services Administration, through the cooperative agreement to the Adolescent and Young Adult Health National Capacity Building Program, and through the cooperative agreement for GOT Transition. And the contents of this presentation are those of the authors and don't represent the official views of or endorsement by HRSA, HHS, or the US government. So our presentation objectives today, we hope to review state and national data that support aligning healthcare transition and the adolescent well visit strategies, identify available resources to prepare adolescents and young adults both with and without special needs for healthcare transition during well visits, and learn a lot about why and how Hawaii Title V, Maternal and Child Health, Adolescent, and Children with Special Needs aligned healthcare transition and adolescent well visit strategies. So I'm pleased to turn it over now to Charlie Irwin.
Sure. Thank you so much, Peggy, and thanks to bringing me and our group into this conversation. with you and with your colleagues from Hawaii. I would say to Dale that my son has kept me up to date when he was going through adolescence and into young adulthood, how difficult the transition was. I remember when he went to the first internal medicine appointment, he calls me from the waiting room and he says, everyone's on machines here. And then I saw this doctor and the questions he was asking me were not even relevant. He must have thought I was 55 years old. So I knew personally how complicated and this process is. And I really am so pleased that Hawaii and Peggy and her group have done so much work. So our resource center really has focused on improving the health of adolescent young adults by really focusing on increasing the capacity of state maternal and child health programs and their clinical partners to address the needs of adolescents and young adults. And I would just say that young adults are really an important part of our resource center, and in most areas they really are underserved. Next slide. Or do I advance? We have 3 partners that work with us. We're based at UCSF through our National Adolescent Health Information Innovation Center. And we have 3 fabulous colleagues, AMCHIP, the Association of Maternal Child Health Programs, and Ileana, you'll be hearing from her today. The State Adolescent Health Resource Center that works with adolescent health coordinators in their respective states to improve organization of services for adolescents in the states. And that is based at the University of Minnesota. And then the National Improvement Partnership Network at the University of Vermont, which supports much of our quality improvement work in our collaborative partnerships that we're doing, a public health arm and a clinical arm of improving access and quality for adolescents and young adults. Next slide, please.
And I'm going to turn it to Annie to carry on. Thank you, Charlie.
Great, thank you very much. So I'm going to start just by sharing a little bit of information about GOT Transition. So we are the federally funded National Resource Center on Healthcare Transition operated by the National Alliance to Advance Adolescent Health. And our overarching aim is to improve the transition from pediatric to adult healthcare through the use of evidence-driven strategies for clinicians and other healthcare professionals, public health programs, payers and plans, youth and young adults, and parents and caregivers. One of our activities that I'll point out is that with partnering with the AAP's National Resource Center for Patient and Family-Centered Medical Home and the Catalyst Center, we operate the National Network for Advancing Systems of Services for Children and Youth with Special Healthcare Needs. So to get ready for this presentation, we wanted to look at all of the states that have selected both the Adolescent Well Visit and the Transition National Performance Measures. And so you can see on the right here, we've just listed the number of states and territories that selected the Adolescent Well Visit, which is NPM 12. So there were 34 states. And then 37 states selected the Transition National Performance Measure. And so we took those 2 lists of states, we did kind of a crosswalk of those lists and found that 22 states and territories in total selected both the Adolescent Well Visit and Transition National Performance Measures. And so those are the states that are depicted in this map in this blue-green color, and these include Hawaii. We're going to hear from them shortly to hear about how they are working to align the 2 national performance measures. So my colleagues at GOT Transition recently published an article where they looked at the 2016 to 2017 National Survey of Children's Health Data. They were looking for associations between the transition preparation among youth with special health care, or just youth, all youth in the US, and other components of a well-functioning system of services. They found that 79% of youth with special healthcare needs and 70% of youth without special healthcare needs had a preventive medical care visit in the past year. And then when they were looking at associations between transition preparation and other components of a well-functioning system of services, they found a positive association between the receipt of early and continuous screening for special healthcare needs among both youth with and without special healthcare needs and transition. And they also found a positive association between transition preparation and the well-functioning system of services as a whole. And so in addition to transition preparation and the early and continuous screening components, there are 4 other components of a well-functioning system of services. Those are partnership, family partnership in decision-making, medical home, adequate insurance, and easy access to services. In 2018, these 3 professional organizations, the American Academy of Pediatrics, American Academy of Family Physicians, and American College of Physicians, published a clinical report on healthcare transition where they provide guidance to clinicians about what transition services should be provided to youth. And they recommend that for all youth with and without special healthcare needs, transition should be part of routine, preventive, primary, specialty, and subspecialty, and mental and behavioral health care. Clinicians should start providing these services early, around ages 12 to 14, and continue into young adulthood. They emphasize the importance of communication, engagement, self-care, and staying connected to care. And they encourage the use of GOT Transition's 6 core elements of healthcare transition. This is the structured transition process that includes transition preparation on the pediatric side, the transfer of care to adult care, and then the integration into adult care. Also in 2018, we at GOT Transition partnered with the Adolescent and Young Adult Health National Resource Center to create a toolkit for clinicians to use to help guide them in how to incorporate transition into preventive care. This toolkit is modeled after the AAP's Bright Futures, where it for 4 different age groups, starting in early adolescence and then middle adolescence, late adolescence, and early adulthood. It describes the transition priorities for each age group and then shares some suggested questions and anticipatory guidance for clinicians to use during preventive care visits with youth and young adults. So with these next few slides, they list just in general a brief description of what the transition priorities are for each of those 4 age groups. And then we have an example of a question that's included in the toolkit. So for early adolescents, the transition priorities are to encourage greater involvement of youth in their own care and to introduce what transition services will be provided to them from the practice. And then one of the sample questions that clinicians can ask youth is, how comfortable do you feel managing your own healthcare, such as explaining your medical condition to others, knowing your allergies and what medications you take and when to take them. Then in middle adolescence, the priorities are to assess transition readiness and self-care skills, explain the practice's transition policy, and moving to an adult model of care at age 18, what that looks like in terms of changes in privacy and consent, for example. And one of the questions that we suggest clinicians ask youth is, what questions do you have about the changes in privacy and consent that happen when you turn 18 and are legally an adult? Next, for late adolescents, the overall priorities are to emphasize an adult model of care, continuing to develop self-care skills, and assist with the actual transfer to adult care. And then a sample question to ask to the young adult is, how can our practice help you find an adult healthcare clinician that you feel comfortable with? Do you have any preferences about your next clinician, such as the clinician's gender or any location? And this is the last age group. So this now here is early adulthood. So the priorities we list are assisting with the transfer to adult care. So if the young adult has not already transferred before age 22, and to encourage continuity of care and continuing to build self-care skills. And one of the sample questions for young adults is, do you need help finding other clinicians, such as clinicians for reproductive health care, specialty care, mental health care? And then there's another tip sheet in the toolkit that I don't have an image of, but it's a motivational interviewing tip sheet that has some questions that clinicians can ask the youth or young adult about how important transition is to them, how confident they feel about their ability to manage their own health. And then based on their responses to those questions, the tip sheet has some suggested action steps or things that the clinicians can say to the young adult to help them become more confident in managing their own healthcare. So that is the broad summary of this toolkit. You can access it on our website at gottransition.org, and then there's also a link to it on the second to last slide of this presentation called Useful Resources. And now I'm going to turn it over to the Hawaii team to start talking about how about their own strategies to align transition and adolescent well visits.
Okay, great. Thank you, Annie. Both Punahou and I are happy to be here to share about Hawaii's partnership of adolescent wellness visits and transition to adult health care. So let's first start off with our org chart that shows where our two programs are located within the Hawaii Department of Health. So on the top box, in the Hawaii Department of Health is the Family Health Services Division, and this division is responsible for Title V. And within the division is Children with Special Health Needs branch, and in this branch is a program that I'm in, the Children and Youth with Special Health Needs program, and we are responsible for NPM 12, Transition to Adult Health Care. And also in the division is Maternal and Child Health branch, who has a adolescent health program, and they are responsible for NPM 10, adolescent wellness visits. And in this program is Punahou Aina and Noella Kong. Okay, next. Why did Hawaii Title V MCH and CYSHM programs partner on addressing these two national performance measures? Well, for NPM 12, in order for a successful transition to adult health care to occur, youth need an adolescent wellness visit with their primary care provider. So it just made sense to partner with the Adolescent Health Program, whose NPM 10 focuses on promoting this wellness visit. Punahou?
Thanks, Dale. You know, being that our activities overlap, and we discovered that they overlap with our adolescent wellness visit activities. You know, a little bit about our activities. We have programs in residential facilities, which are community-based organizations, and we have partnership with community collaboratives. This opportunity provided a chance for us to share tools, knowledge, and resources to assist each other in moving the needle on our performance measures. Furthermore, this partnership provided access to populations not typically served by each of our individual programs. Next, please. The establishment of this, how did Hawaii go about planning and implementing this collaborative work? The establishment of the partnership seems spontaneous and due to timing, but it actually goes back to years of collaboration. In 2018, there was a division-wide collaboration called We Are Family, because we are the Family Health Services Division. This created an opportunity to learn and share what we do in our respective branches, sections, units, and programs, and a chance to strengthen relationships and discover opportunities to intersect, collaborate, and maximize our resources. Also in 2018, Department of Health and the Department of Human Services participate in the One Shared Future program, which helps organizations to innovate, transform, and embrace collaboration within their own organization and across the public, private, and nonprofit sectors. Dale and I were fortunate to be two of the participants in this program. The following year, Dale and I participated in the Hawaii Maternal Child Health LEND program, which prepares its participants to take on leadership roles within their organization to improve support and services for children with special health needs and their family members. These collaborations definitely help to create a trusting and valued relationship. The timing was just right for our participation that was about to come in the maternal child health workforce development training, of which Dell will share with you in a moment. Another contributing factor was proximity. Our branches are both located a stone's throw away from each other up in the hills of Diamond Head. And I specifically use Diamond Head because most people understand where Diamond Head is. It's beautiful in all the pictures of Waikiki of Hawaii. Like I mentioned, they're just a stone's throw away, and we see each other on our way into work. And as we head to our cars, I can tell you, this has generated many parking lot planning meetings. Dale?
Thank you. Okay, next slide. Okay, so as Punahou mentioned, in 2019, both programs participated in the MCH Workforce Development Training Center in North Carolina. It was an intensive training where we created goals and objectives, and we learned tools to use in our project. We returned to Hawaii with valuable lessons on how to plan and implement a project and of knowing our target audience. And we use this information to update and regroup. Okay, next. This is a screenshot of one of the activities we did at the training. We developed an aim statement and short and long-term goals. And as you can see in the short-term goals, we included number 6, collaboration between CSH&B and MCHB on the pilot project. And in the long-term goals, we listed each of our national performance measures. So we took the step of making our partnership official by putting it on paper. Okay, next. And a few months after our training in North Carolina, we had a statewide meeting that included all staff from both of our programs. And we also invited Hilo Pa'a, who is our family-to-family organization, and also a young adult and her mother. And spending 2 full days working and learning brought both of our programs together. And at the end of the training, staff commented that they had a better understanding of Title V and their role in promoting transition and the importance of annual wellness visits. Okay, next. What are examples of training, tools, and new partnerships Hawaii has put in place? Next. So this is my path to adult healthcare handout, which we call the PATH for short. And you can download a copy in the link at the top of the slide. So in 2018, we adapted information from GOT Transition and developed this handout to be used with youth with and without special health needs. It lists skills in 5 categories that would help children reach their goal of successful transition to adult health care. As a result of our MCH workforce training, the handout was revised in 2020 with Adolescent Health Program to include information on the importance of medical home and annual wellness visit. Punahou?
Yeah, thanks, Del. I would be remiss if I did not mention that, in all our collaborations up to this point, we did come to the understanding that despite having special needs or not having special needs, both of the populations that we serve were encountering the same challenges with transition. So we, as the Adolescent Hope program, utilize the path with our community-based programs that serve adolescents and young adults. We train our staff to be well-versed in which tools they think works best with the population they serve. And this has been vital in starting the conversation about one's health insurance and access to info needed to make their own wellness visits. Next, please.
Okay, so this is a Footsteps to Transition flyer, and you can download it at the link at the top. We also revised this flyer to include information on annual wellness visits. This flyer lists skills in the areas of adult health care, after high school, and taking responsibility. We use this form at health fairs and other educational opportunities, but Punahou took it one step further and used the Footstep flyers as an assessment tool and teaching tool. So Punahou will explain how he used it with their population. Next.
Thank you, Del. So we contracted with the Kawailoa Youth and Family Wellness Center, also known as the Hawaii Youth Correctional Facility, which serves incarcerated youth. We utilize the Footsteps flyer to determine what the youth already know with regards to a healthy adulthood. And if you take a look at our flyer, we handed a flyer to every youth and had them check off what they already knew. The slide actually shows the tally results of our survey. This helped guide our strategies and program implementation planning, such as lesson selection for our top clubs, guest speakers, and community service learning projects. We also, because of this, added healthcare transition information to our adolescent health curriculum, and our facilitators over at the correctional facility use the path as an opportunity to begin conversations about adolescent well visits, doctor's appointments, and health insurance. Next, please.
Currently, both programs are working with TeenLink Hawaii to help spread evidence-based health information. You can go to their website at teenlinkhawaii.org or to their Instagram or Facebook page at #TeenLinkHawaii. It is a go-to site on topics of interest for youth and young adults that includes health and wellness information. The website and posts are developed by teens and young adults for teens and young adults. We are currently working with TeenLink Hawaii to develop messaging specific for children with special health needs. Next.
So our adolescent program, in partnership with the Coalition for a Drug-Free Hawaii, who is the home for the TeenLink, we developed an adolescent resource toolkit, or ART, to promote adolescent health and annual wellness visits. The ART focuses on building adolescent knowledge, behavior, and skills to access healthcare and also community resources. Using the ART, health educators and outreach staff can share and connect teens to service or healthcare. The ART includes information adapted from the Special Health Needs Program transition materials to increase adolescents' confidence to access healthcare services and also strengthen independent life skills. I would like to mention that in the needs assessment, if you take a look at our slide, there's a mask there, and it was a word cloud. And based on the amount of times a word was mentioned on the needs assessment, determined how big that word would appear on our word cloud here. And interesting enough, based on that needs assessment, the youth at that time, sleep was their biggest concern during COVID, specifically losing sleep over schoolwork because of COVID. All of this great information are on TeenLink Hawaii. You can take a look at it at teenlinkhawaii.org. Next, please.
Okay, so you may be asking how to start the NPM 10-12 partnership. So the first thing to do is make that deliberate outreach to each other to make that connection.
Yes, Del. That was like we mentioned in our slides earlier, is that all those collaborations made for the opportunity to create valued relationships that help down the line.
Right. And then you can also take a look at your state's annual Title V Block Grant Report that highlights activities that were done in the previous year by each of the NPMs. And what really worked for us is having an all-staff mini retreat in a location away from the office. Use this meeting to learn about each other's NPMs and ESMs, develop a joint aim statement with goals and objectives, and you can also brainstorm ways to work and partner together. Okay, and also review your tools, handouts, brochures, and other educational material to see how they can be revised to share the messaging of both NPMs.
This was, I think, one of the important things that happened was when we laid out the work that we're doing and the tools that we're using, we discovered that there was many opportunities to intersect and to align the work that we're doing without having to create extra things. So I think that was very vital in the success of what we're doing thus far.
Right, correct. And then also look at your resources to see how you can share them, such as access to specific populations, your partnerships, and your knowledge. Okay, next. What are our future plans? Or what are our plans for the future? Our two programs have agreed to promote both messages of adolescent wellness visits and transition in all our future projects. CYS and HMP will continue to work on strategies to engage youth and young adults on transition. We'll continue to work on messaging and tools for transition and annual wellness visits for youth with special health needs. And we currently are conducting 2 needs assessment. One is on transition messaging on digital platforms for all youth, and the other is on transition messaging specific for youth with special health care needs. Okay, Punahou?
Sure. For the Adolescent Health Program, we will continue our partnership with Teen Link Hawaii in the creation of a young adult toolkit, which will focus on workforce development, healthy relationships, and the importance of transitioning into adult health. And I think even one that's overlooked is their rights as young adults. We will also incorporate what we're currently implementing with every program that we expand our adolescent health program. So we will utilize the path footsteps in our work with those populations to gather data to help drive our strategies.
Okay, next. Hey, this is our contact information. Please feel free to reach out to us if you have any questions or want more information on transition, adolescent wellness visits, or on our partnership. So the picture you see on the right is a poster we created in the MCH Workforce Development, and Punahou will explain it.
Thank you, Dale. On our last day of our MCH Workforce Development Training, we were tasked with creating a logo that best represents our work with moving the needle on our performance measures. Our team came up with this. The waves symbolize change and continuity through change, not to mention the connection between the islands. So if you take a look, we have our waves up on the top and we have the names of our islands. And during turbulent times and calm times, it symbolized, the continuity and our role in being that steadfastness through that turbulence. The footsteps symbolize how we walk along our youth on their journey as they transition into adulthood. And lastly, the lei of aloha that holds everything together. Everything we do with aloha. Being open and honest with humility, aloha is accepting others for who they are and showing dignity to what they have to offer. And lastly, we use imua kako, which means moving forward together. We would like to thank each and every one of you for spending your time with us. And mahalo each and every one of you. Thank you very much.
Wow, that was tremendous. I can't thank you enough for your brilliant presentation and the interchange between your two programs and the two of you was really awesome. I want to just highlight a few resources we have here and then begin to open it up for questions and any other kind of reflections from other state agencies that might be doing some interesting work on aligning these two important measures. So in terms of some resources on gut transition, we recently did a review of the 2021 block grant reports, and you see the link there. We also have a Title V page on the gut transition resource website, and this webinar will be posted there. And then Annie's incorporating healthcare transition services, and then some additional healthcare transition resources. We also, just by the way, with a group of youth leaders from Wisconsin Patch, created a very short video on what is healthcare transition. And then I want to let you know about resources on the Adolescent Well Visit that is on the Adolescent and Young Adult Health National Resource Center website. And they've done a wonderful job with a change package on increasing well visit uptake, quality and policy, and then an adolescent well visit toolkit for clinicians. So I encourage you to check that out. And the next slide has our contact information. And I want to just lead into this, but I think they're just in terms of reflection on what went on with Hawaii. I think what's really important here is the intentionality of the alignment efforts that you worked on. It didn't just happen. It was a very organized process of collaboration. And to just imagine the ability to reach so many new audiences, I think was a brilliant opportunity. I know sometimes when we're in the lane of transition, we wish that transition was not an afterthought. And it's very evident in what you've done here that it's just well integrated. And the terminology that you use of path and footsteps, and your last visual was terrific. So I also wanted to see if you could say a little bit more about the decision to select your pilot with the incarcerated youth. You mentioned that it was a population that you had, it was a new population. And so I wonder if you could say a little bit more about the importance of that as a pilot effort.
Definitely, I can expand a little bit. You know, it was a smaller group. You know, it was a smaller sampling. It felt like we have a really good relationship with the facilitators and access. I think it was easier access to a training, a day training with the facilitators and how to carry out the survey. And like I mentioned, that group is very underserved. So we thought that would be a great opportunity for us to gather, I think, great data to help drive our strategies. You know, I would be remiss if I didn't mention Noella Kong is my supervisor, my mentor, my needle that points me in the right direction. If it was not for her, I would be directionless. Noelle, if you wanted to expand a little bit on that.
Thank you for the kind words. The working with the Kauai law, well, it's in these times, actually during this pandemic, we found the organizations and populations we've been working with, their management is a little bit more open now to suggestions in moving their adolescents and young adults forward, recognizing that they are transitioning into adulthood a little sooner than the regular, I forgot that word that Dale uses, but the adolescents that still live at home. They recognize too that the facilitators and the youth correction officers are the parents or caring supportive adults. So the youth correction officers and the administration of Hawaii's correctional facility has been very open in receiving our suggestions and taking our surveys and suggestions via the teen outreach program curriculum and whatnot, and reporting back to us, and that has made for a great success and for us to move forward with the young adults at that are homeless and unaccompanied, which is what we'll be working forward on this coming fiscal year. Thank
Wonderful. Thank you. I see Charlie has a comment in the chat. I'm just wondering if you could ask it, Charlie.
Well, it's about the Cures Act, and you know that adolescents really now have access to their medical records. Parents have access to these records. Confidential care is complicated because how we carve that out. So adolescents still have some privacy with all of this, and I'm, you know, it seems to me this might be an opportunity to increase kind of the transition process, because they've got this material in their hands which they previously didn't have, and how we might work with it. I don't have a solution to it. I'm just kind of, we're struggling with it here at UCSF, how we make certain that we protect what's confidential, and yet what we're writing in the charts, and how to really increase this as an educational process, not to think about it as a hassle.
I think just building on Charlie's comment or reflection, I'm wondering about any connection that your two programs might be having with the Hawaii AAP chapter, again, building out the partnerships, which I imagine you've long had great relations with the chapter.
Yes, well, one of the pediatrician group that we work with is Dr. Kawaoka at Kaiser, and I think she's on this call here. She's one of the participants. Yeah, so it's we worked on some transition and did a training. So at Kaiser, they've incorporated the handout, The Path, in their adolescent wellness visits. And I believe they use it on all their wellness visits with their patients. So it's great to see that such a big organization has taken on transition to adult health care, you know, and has put it in their policy and protocol for their patients. Yeah.
Thank you, Dale. other questions or comments or examples from the audience about efforts that you have been working on to align the two, transition and preventive care? I'm just going to, in the moment where there's not a quick response, I'm going to just give an example of work that we've done in the District of Columbia with the Medicaid EPSDT program. They allowed us to work with them on developing some content on transition for the, as part of the EPSDT training for the pediatric providers. Again, just another example of partnerships that can be happening.
Oh, I see that Tammy has her hand up.
Tammy, I can unmute you so that you can ask your question or make your comment.
All right. I think I unmuted myself here now. Can you hear me okay?
Yes.
Yes.
Okay. Well, I am here in Iowa, and we have going on a community-based transition plan that is focused on healthcare transition from the perspective of the adult care providers being prepared and confident in their treatment of individuals with intellectual and developmental disabilities that might need a different sort of office visit per se, or maybe have some disability related health issues that the standard family practice doctor might not be up on. And so that's a little bit different side of this. You know, doing all the things that you're talking about is certainly part of it. But from what I heard, it seems like the training or the emphasis is on the individual young person being proactive about their health and understanding it versus the health system being competent or competent in the care of individuals with special healthcare needs or that kind of thing. So is there anybody have a comment on that, or I don't know, some thoughts?
I don't know if our Hawaii colleagues want to make a comment on that.
Well, definitely, you know, the pediatric system and the adult system is so different, right? And our emphasis is on getting the teen, the young adult ready for this transition. But there definitely has to be some preparation on the adult provider side that, you know, that for one thing, that we have enough adult specialists for our children with special health needs to transition to. You know, that can be a problem, especially in the remote areas. And then also having the adult specialists being familiar with childhood diseases, right? You know,
Yeah.
if they, right? So, yeah. Noelle, you had a comment on this?
Yes, that was the purpose of our health and wellness toolkit on the Teen Link Hawaii website. But it all began from an adolescent resource toolkit that New Mexico had sent to us. And we tweaked that through the years so that we're trying to help adolescents help themselves. And so some of the steps that were shown in the footsteps in the beach flyer helped us to nail down what kind of information the adolescents and young adults should have access to or in their possession, such as their social security card, their HMS, their health insurance, who their health insurance carrier is, how to make appointments, what to say to the receptionist or whoever, so that they can make their own, they can do things on their own and be prepared for to take on those responsibilities. And we continue to try and figure out what other information we can put onto the website. And again, the website itself, we realize that it's more for the adults and maybe young adults, but on the Teen Link Hawaii website is also Instagrams and social media platforms that that may relate better to the adolescents. That's my comment. So I agree with you, Tammy.
Thank you.
Right, Linda Starnes, would you like to, I see you have your hand raised.
Yes. Hey, can you hear me?
Yes.
Hey, this is Linda Starnes, and I'm over in Orlando, Florida, and I work with our state Title V Children and Youth with Special Health Needs program, as well as the statewide family leader. And healthcare transition is near and dear to my heart, as well as Angie Chatfield, who's on with us today too. And she and I and a couple of other folks in our office have just started an initiative with our adolescent health office. And it started out with talking about bullying prevention, and we're linking together because in their offices focus on teaching about sexual health, is healthy relationships, discussions regarding healthy relationships. And so we found some linkage there, and we're helping them and being better and more inclusive of youth with special health care needs within the educational activities that they are doing across the state. But I bring this up because I'm wondering if that is any of the part of the healthy path, healthy steps activities that you all have set up in Hawaii, because I couldn't read the fine print quick enough to see, but we're just looking for ideas and information on that.
Yeah, you touched upon a really great point about establishing relationships. We kind of like to call it the Jedi mind trick, where our youth in the utilization of the path, we're creating this relationship with the facilitators, one caring adult individual with our youth. It's been really vital, in addition to the youth becoming aware of what questions and what information that they need to know, they're creating these relationships with these adults so that they feel empowered to go back to them even when they're out of incarceration. I've heard there's been numerous accounts where they've called back to the facility, or they've continued seeking mentorship from these adults to help them navigate adulthood, young adulthood, I should say.
Okay, thank you.
Other comments or reflections or questions? I want to get back to Tammy's comment about, the issues creating a workforce on the adult side, particularly for underserved populations, including those with developmental disabilities. I think that the Title V program has for years been involved in some really exciting workforce development issues. And certainly this is an area of systems building that continues to need additional attention. And so hopefully more Title V programs will find their way into this workforce development area on the adult side.
Our partnership in Iowa involves our Title V group and our program for children with special health care needs and that transition. I don't have all the lingo quite right on the, I don't even know what you call them, national performance measures. But we are in partnership with them quite heavily. So that's really a good thing for us.
Mhm. I also had a question for the Hawaii group. Again, you have connected the dots around reproductive care, or reached that out to that partnering group, the PrEP group. Have you done any work with any of the reproductive health providers around the transition as part of the young adult, the Well Women preventive visit effort measure?
No, we haven't started that yet. But that's a good thing to think about. Because I was thinking, like, no, but that is one of the NPMs. I believe
Yes.
that's
Yeah,
NPM
and when we were,
3.
go ahead.
Yeah, go ahead.
When we were looking at the block grant reports, again, we looked at those states that selected transition and the adolescent, and the well woman preventive medicine. And we didn't really see much written up about the connectedness here. But I think that is something going forward that's a need as well. And I think that the notion of the efficiencies that are gained and the cross learnings that are gained from examples like Hawaii are pretty outstanding. So I want to, on behalf of GOT Transition and the Adolescent and Young Adult National Resource Center, extend our deep thanks to the Hawaii leaders for sharing their wonderful story. And we will be posting this on the GOT Transition website in the coming days. And again, thank you very much. And I hope you all have a wonderful rest of the week.